It depends.
Okay.
So I've written 20-page documents before, and I've written 2-page documents. It really, really depends. So, the best place to go would be here where the behavior treatment protocol is. There's different templates here, but one of them is really just a check-in, right? Like a quality review check-in. That is like you're in where we are anyways. That's kind of your ultimate standard. And that would be like pulling out things from the IEP, putting them on the template, working on things like that. So that would be kind of the quality review piece. But if you're looking at just a standard template, let me just open this up again and share, really as simple as you possibly can, because people are reading this, right? You want people to read it. And if it's 20 pages, you can guarantee people are not reading it. It's going in a binder somewhere. It's getting put, in someone's file, and it's not being looked at. If it's 2 pages long, or if it's 4 pages, but it's really big font, people are going to read it. The really big thing on there is, what is the behavior? What's the definition of the behavior? Maybe it's, this behavior is this, but it's not this. Like, really be clear on that. That's huge. And then the function, that's huge, right? The function and the triggers. So if I'm a student, or if I'm a teacher, I'm a substitute teacher coming in, working with a student, and I need to know a really quick thing, I can look at this and go, okay, this kid hits, and it's usually when I place demand. Okay, got it. Really snap, a snippet of that. And then what we do is we typically put in antecedent intervention. So I want to know everything that we're doing from a positive behavioral support place, what we're doing. So we've got some functional communication in, we're teaching that replacement behavior, visual schedule, this, that, what have you. This is just a template. But here's a whole bunch of things we can be doing. From a consequence standpoint, really, what do we do after the behavior? There's not a lot of things we can do besides, block aggression, keep everybody safe, etc. But that's really all that I would put on, a quick, like, 1-pager or 2-pager doc of like, here's what you really need to read for that. But a true behavior support plan does include, here's the things from the IEP, and here's how to teach them, etc. And that's when it becomes a 20-page document. And if I'm writing a 20 or 30-page document, I'm also writing a 2-page document of a summary, because people aren't reading that part.
I'll tell you what I do. I mean, I have a different type of school role, but on our IEP, there's just a box that they can check. The teacher will check if there's a behavior plan. Just because so many of our students already are using all these antecedent strategies, that they'll have like basic behavior management goals as part of their IEP. And that's really all the students. So like behavior management goals will be things like, attending, compliance, reducing aggressive behavior, things like that. And it's only like when it's beyond that they'll require a behavior plan, when it's kind of above and beyond the level. It's included on the IEP, but there's just a little box that says this student has a behavior plan, and then they're kind of redirected to the behavior plan. So it's kind of a separate document. And it usually overlaps with the IEP goals, but they're not directly part of the IEP.